3 months ago, I injured my back. Since then, I've seen physiotherapists, chiropractors, neurologists, and doctors. I've had 2 MRIs, but nobody can agree exactly what's wrong. So today, I'm taking my 2 scans to 2 of the top spine specialists in Western China. Will they finally agree on a diagnosis or completely disagree? Got my 2 scans here. This is Huaxi Hospital. It's widely regarded as the best hospital in Western Sichuan. It's also the busiest hospital. So we're going to go in there and contend with the crowds. We've basically got people from all over Sichuan, the province here, coming to this hospital, down perhaps in Yunnan province, and certainly the province of Tibet. When they have a problem other doctors can't solve, they come here. And that's why I've come to see top specialists at this hospital, despite the crowds. I like almost everything about China. What I don't like is that people don't stand on one side of the escalator. It's always both sides. Queuing is also a bit of an issue, but the escalator really gets me. I am British, so yeah. I'm now waiting for specialist number 1. In the Chinese system, that is an Erji Drunjia, so basically the second level. I'm going to wait to see him first. And then I've got the next doctor's appointment, the next specialist right after. Hopefully it all works out well. Guys, you see the nurses station behind me? So people always ask me, how do Chinese hospitals work? How can I navigate it myself? So basically you book your appointment online. I know some people say that's difficult, but for me it's easy. Just do it on WeChat, book it online. You come to the hospital at your allotted time. You go to your selected area. So I'm in this area, area D, and if you can see that behind me. And then you basically have to register with the nurse or sign in. Once I sign in, I get this ticket. Now, some hospitals are different. Some are purely electronic. In fact, this hospital used to just be electronic. You just get the QR code, sign it, it's all on your phone. But recently, and I asked them about this just now, they said a lot of people couldn't understand the system. I guess old people, a lot of old people go to the hospital. So now it's get here, queue up over there, as you can see, and you show them your phone or your appointment and they give you this ticket. Now the next step is basically to wait here. My name will be called, they'll do their best with an international name, an English name, and then I'll go in to see the doctor. Guys, in this hospital especially, with this many people, I don't know how patient the doctor is going to be in terms of me going in with a camera. So if I can't film inside, as soon as I get out, I'm going to give you the report, basically what the doctor tells me. So fingers crossed. Before I sign in with the nurse, I'm going to go over my symptoms. So basically, in October of 2025, I had a back injury. Nothing major, I was swimming, twisted my body, felt really quite uncomfortable. But after a few weeks, I was basically better and playing football. Then in November, December of that same year, I got a little tingling sensation in my thigh. Went to see a doctor, said, if it doesn't change or if it doesn't get bigger, don't worry about it. It got bigger. I noticed it was tingling, it was that numbness, that pins and needles we say in British English. And then what happened, I had a back injury in March. So not only did the numbness become, electrical pulses become pain, it spread over my leg until my whole thigh, and even I'd say sort of the back, my buttocks almost, was in pain. Now what's happened now is, my back isn't completely recovered. But I can walk, I can sit down, I can sort of, function normally for the most part. But my leg, I feel, is getting worse and worse, and that's super worrying for me. But now I've come to the specialist, and hopefully they're going to give me a diagnosis, because so far the people I've seen say it's a bit like sciatica, it's in the wrong place for sciatica, it's possibly 2 problems. Just keep going with physiotherapy, keep going with medicine, which is basically painkillers, surgery, injections. I need a bit of direction, and that's why I've come to the specialist. By the way, guys, all of the prices for today, keep watching to the end and I'll give you all of the prices. I've spent more than I would normally pay in a normal hospital. This, again, is the top hospital in Western China and one of the top hospitals in China. So let's hope these 2 specialists can give a concrete diagnosis. And what I'm really interested to know is, do they give the same diagnosis? I hope they do. And I hope it's an easy fix. I already stick out like a sore thumb, but when I start speaking English, get the camera out even more so. You can see I'm waiting for this doctor. And as I said before, he's a 2nd level doctor, so really high level up. I'm in people's way, I'm waiting. But I mean, look, this is the system, this is the corridor, there are no seats.
This is not one of the, the VIP departments, although this hospital does have a VIP department. I think I should check it out for you guys because it's so many messages saying I want to come to China to see doctors. I don't think you guys want this. I think you guys want the VIP section. So another time I'll see the VIP section. But today I just want to see the best doctor I can. So that's why I'm here in a corridor with no seats, waiting to be seen. I've just come out of the doctor's office, the first doctor. What surprised me was he very quickly said operation. All in Chinese, but like minimal invasive operation in your back, where basically, I think my understanding is correct, they take the disc out, they sort of chop off or use sandpaper, the equivalent of medical sandpaper, to reduce the size of the disc and then sort of put it back in. Apparently it's a very small operation, but he did say there are risks. He talked about 95% success rate, 5% you wake up and you can't really feel your foot, which is scary. He said, look, I've still got strength in my legs, but he seems to think it's sciatica. He seems to think sciatica. I said, look, on this side, from my buttock to the front of my thigh, down my knee, he just seemed to think that's sciatica. And he had good English, but obviously doctor in China wants to speak Chinese, but he said sciatica in English. At least one of the problems is sciatica. Whether I've got a second one or not, I'm still not sure. I'll find out from this doctor, hopefully. What I disagree with is, I don't know if I disagree. He said, look, go for conservative therapy for a few more months, and if in a couple of months it's getting worse, then come back to me and we'll organise for an operation. It is already getting worse. I guess I want a resolution too quickly, but at the same time I don't want an operation. Unless an operation is guaranteed successful, which is not. In Chinese, 纠结, which means undecided. It's complicated, isn't it? Right, that's the first doctor, specialist, spine specialist. That's a level 2. Now I'm going to see a level 1 specialist, the top spine specialist. I'm waiting for my second doctor's opinion. You can see here it says E, that's 1, so top level, first level. His price to see this doctor is more than the other doctor. In fact, almost double. By the way, guys, if you're interested in the prices and so on, I don't know what I'm looking for from this guy. The same? Does he tell me the same diagnosis? 2 experts tell me the same thing? Then I can be sort of fairly certain of what's wrong with me. He says something different? Then I'm back to square one. Let's see. 顾盆牵引. This is what's written on this form. 顾盆牵引 on a piece of paper. So, bloody hell, I don't know what to feel. It's a busy hospital. Probably the top spine specialist. And what did he say? Well, I'll tell you now, he didn't say exactly what the other doctor said. He said, the exercise I'm doing right now probably aren't helping that much, putting perhaps more pressure on the back. He didn't go straight for sciatica. He said, do some different medicine. Don't take the medicine you're taking now, which is not what the last doctor said. The last doctor said, take that medicine. Oh, God. And now he says, I've got to do this. Gu Pen Chen Yin, some kind of like stretching. I'm not exactly sure what that is. But I think, he said I didn't have to do it here. He said I could just do it in the local clinics. He said most local clinics where I live will have it. So I'm going to look at this. I'm guessing it's some form of Pilates. I think it sounds like some form of Pilates. I don't know what it is. Perhaps people who are better Chinese than me, I need to look this up. Gu Pen Chen Yin, I've never heard of it before. Which he's given me a prescription for. And he says, go for this first of all. I mean, look, they both said, what did they both say? It was exactly the same. They said continue with conservative treatment, don't go straight for an operation. They both said if you need an operation, you can have that minor operation, that small incision in your back, shave off the protruding disc, put it back in, and perhaps the next day you can just leave the hospital. They both said that. They both said conservative treatment. However, this guy, the top level specialist, said do this and change medicine. That guy said keep the same medicine. I don't know. Am I more confused? Guys, I wanted to show you the 2 MRIs, but honestly, without one of those sort of special MRI things, that sort of illuminated board, you can't really see. But you can see here I've got 2 MRIs. Yeah, there it is. Sorry, I don't know if this is useful or not. Guys, if you've done MRIs and you don't care too much about your privacy and you want to put a picture in the comments below, do so. I'm no expert, but God, I've looked at these MRIs so many times. I don't mind looking again. Let's compare. L4, L5, L5S1. It's so busy in here. There's like 33 booths for dispensing the medicine. There's so many people. I never come to this hospital. I try not to, unless it's an emergency like this is. Even I, the king of Chinese hospitals, no. That's a joke. Even I don't know what to do with this code. I paid for the medicine. Now what do I do with this in order to get the medicine? Not even I know. 收桌子咋办？我的药已经付费了，怎么办？下一步是啥？这儿吗？小陈哈，可以了吗？我缴了费的。这个哪样？啊，这上面有。有吗 ？Apparently, I don't know where. He's done it for me on the machine. Which booth do I go to? It doesn't say. Oh, 31号, 31. It did say. All right. Pay the medicine using WeChat. Pay for the medicine using WeChat. Go up to one of these machines. Get a second ticket. And then, oh, there, it's got my name. Here we go. My name's so easy to spot because it's an English name. Yeah. 出口 means exit in Chinese. I'm out, and I'm actually, honestly, really glad to be out. That is such a busy, busy hospital. Guys, I've made a lot of hospital videos about China and in China. If you're interested, if you want more information about that stuff, do get in contact with me. What I'd like to do is to show you what the VIP section of this hospital. On that note, if you do see me in the future doing any advertising on this channel, I am talking to some advertisers. Do please watch and give it a like and all the rest of it, because the money I make from that will then perhaps allow me to go and see some VIP hospitals and show you guys that kind of stuff. I came here, guys. What did I end up with? I promised you I'd tell you the prices and everything. Finally, I got some medicine. I've got this. Remember the second doctor? He gave me the gabapentin capsules, and he's given me some painkillers, tramadol. Do I take this medicine or do you take the other medicine? That I haven't decided yet. This medicine cost me 34 RMB together, which is about £3.50. It's about 9 RMB to the pound now. The first doctor, the second highest level of doctor, surgeon they have here in the country, that cost me about 50 RMB, 50, so about £5 or less than £5. And the second doctor, the top level, the highest ranking doctor they have in China, I mean, there are multiple of him, it's not just him, but it's the highest level. He costs around 90 RMB, 90, so a little less than £9. I'm sure a lot of you guys are going to say cheap, but in the other hospitals I've taken you to, most of those guys are like 10 RMB, less than £1. Whether they're better or not, I don't know. But it is well known, well regarded in this country that the doctors in this hospital are probably the best. What do I feel? Do I feel they're the best or not? Well, that's such a subjective, difficult question to answer. Whoever cures me is the best. Whoever cures me is the best. What I'm struggling with now is I've got slightly different answers from two specialists. But they both say conservative care first, and they both say there is an operation available. I don't want to have an operation if I don't have to, right? Who does? I've got a trip to Britain planned over the summer. I want to get over that, or I should say enjoy that. and then maybe I'll think about, come September. Isn't there a song? When September comes, maybe I'll take a view. That'll be 2.5-3 months from now, and then I'll have given it a go. On the one hand, I just want to do the operation because I think it might work, just get it over with and get on with my life. On the other hand, like a reasonable person, you try and avoid an operation, don't you? Because you never know what you're going to be like after. So guys, look, thank you very much for being on this journey with me. It started as a China channel, it still is a China channel, but thank you for following me on this sort of personal path, hopefully, fingers crossed, to recovery. And in the meantime, I hope you've enjoyed it, found it entertaining. If I have gone on for a bit too long, I do apologise for that. Hopefully you've learned something. And as ever, if you have any questions about living in China, going to hospitals in China, sourcing, manufacturing in China, which is actually my field, then do send me a message, comment, or send me an email, go to the website, etc. But for me, Toby, here in China, for China Unpacked, that's a wrap. 谢谢. 再见. Oh, this is nice. These are the graduates, because of course this hospital is attached to the university. These are all the young graduates going off to be doctors, not just in this city, but around China, perhaps around the world, because they're so well regarded. Well done their graduation. Perhaps you'll be seeing one of them in the near future. Hopefully not. I wish you all health. Stay healthy, everybody. Bye-bye.